So you have cracked, bleeding nipples. What do? The usual recommendation is to put kind of something topical on it, like a nipple cream or a lanolin. That doesn't really help the problem, because what happens is if there's a wound on the nipple, hopefully you'll fix it with a nipple shield, but a scab develops. So you have a wound on your nipple, it develops a scab, and then you put the baby on the breast every 3 hours. Guess what? The scab rips off and then it starts bleeding, and it's just kind of this ongoing problem. So these are hydrogel pads. My personal favorite are from Amita. This is considered wet wound healing. So wet wound healing heals with moisture. So that scab never develops. So it doesn't have to rip off. It doesn't have to bleed. So you see, I just took it out of the package and it curled this way. That tells me that this is what's gonna go on the nipple. 1 pack lasts 6 days, and you just keep using it over and over and over again. If you drop it on the floor, just rinse it with water. If you are miserable, you can put them in the fridge or the freezer and get them all nice and cold. But to go back to the breast milk, 1 drop of breast milk has 1 million living white blood cells. Those white blood cells will kill any bacteria, so you don't have to worry about sanitizing these. So why would we want to do wet wound healing over, for example, coconut oil or lanolin? Is that you put these in your bra and you leave them there the entire time. You only take them off when you're breastfeeding. And this heals the wounds so that you don't have any bleeding. So Amita Comfort Gel Pads, life-changing. But again, if you do have nipple pain, the last past the first 30 seconds, there could be an issue with tongue tie, or your baby kind of sucked their thumb in utero. You can definitely have the baby looked at by a pediatric dentist or an ENT, but a quick fix for that would be to use a nipple shield until you can get to that appointment and see why the latch is a problem.